I'm Dr. Richard Glassock. I'm from the United States. I'm affiliated with the UCLA School of Medicine in Los Angeles, and I have attended this meeting before. I just arrived last night, and I'm attending the first part of the meetings this afternoon. Well, this is the third Congress I've been to. The first one was in 2010. Then I went to the one in 2015. And each of these meetings has been a real joy. The people who present are very fine scientists and clinicians, and the material is very up to date and often extremely practical for patient care. Well, the topics are very diverse, ranging all the way from glomerular disease of the kidney, which is my specialty, to transplantation, hypertension, and of course advanced kidney disease and its treatment by dialysis, either hemodialysis or peritoneal dialysis. So it's quite a diverse program, and I'm sure that everyone attending is going to learn a lot during this year's session. Well, membranous nephropathy is a very common cause of the nephrotic syndrome in adults. We've known a lot about it for the last 50 years, but within the last 8 years or so, we really have come to understand this disorder in great detail. And what I'm going to talk about at this meeting is how to translate this new information into a process for diagnosis, prognosis, and management, which I think is going to greatly improve outcomes, life expectancy, and quality of care for patients who suffer from this condition. Well, systemic forms of vasculitis, or inflammation of the blood vessels, is a very common disorder in older people. It does not tend to be a very common disease in children and young adults, but it's certainly quite common in elderly people. It's a difficult, dangerous disease with, untreated, a very high likelihood of a bad outcome. Nowadays, we understand how to diagnose it better, and certainly in the last 5 to 10 years, we've learned how to treat it very efficiently, such that the majority of patients now can be controlled. In fact, many of them can even be cured of this disease by proper application of modern drugs, accompanied by better procedures for following the patients during treatment.